You're listening to Advice from Your Advocates, a show where we provide elder law advice to professionals who work with the elderly and their families.
Welcome back to Advice from Your Advocates. I'm Bob Mannor. I'm a board-certified elder law attorney in Michigan, and I'm really excited about the show today. I think you'll find this very interesting. We've got Laura Lynn Morrissey from Silver Savvy. Welcome, Laura Lynn.
Thank you. Nice to be here.
So I wanted to hear more about you as a person and how you got to be where you are and the services that you offer. But first, tell us a little bit about Silver Savvy and how it came about and what you do.
Well, Silver Savvy is actually, it's kind of an outgrowth of the work that I've done throughout my career. What I saw in a need for is advocacy and more comprehensive, holistic resources in one place, and a personalized approach for those of us who are navigating and want to age well and informed. I think that there's a lot of misinformation out there around aging and what it means to be, an older, mature adult. And the experience that I've had in healthcare and then prior to that in financial services, I'm really a bit of a unicorn because I've seen how we're perceived as we get older, and I see how we're treated in the healthcare industry and navigating all of the complexities that are coming at us, oftentimes in crisis. So I saw, when I got out of healthcare, I saw myself as an advocate. I call myself BFF for aging well, but an advocate for those who are looking to age as well as possible, or maybe they're in a situation where they need guidance for certain services that I provide, but also for the daughters and daughters-in-law and loved ones that are also in the middle of all of this. So I really service two demographics, two types of clients. And where it's been well received, both on the B2B level as well as folks on the retail side. The services that we do provide include, it's kind of a threefold offering. So we have curated products. So I have experienced healthcare and understand the different types of products that I think work well. I also use a lot of products. I'm a very active person. So if you want to pursue active living, we have lots of products to help with that. So we have curated products that I know and love very well or recommend, but also services around long-term care insurance. So many of us who have long-term care insurance don't necessarily know exactly how to file a claim, or maybe they've filed a claim and have had issues. So I'm here to help, or pursue finding a suitable home care company, given that home care is now part of the healthcare ecosystem, unlike several years ago before COVID. And then finally, I became a functional aging specialist, including a fitness trainer, believe it or not, and nutritionist. So I kind of understand how the body ages and what we can do to offset that, along with good health and good eating.
Laura Lynn, as we were talking, and for the audience that knows me a little bit better, I feel like we have a similar philosophy in the way that we approach this. That there is a lot of information, but it's disjointed information out there. And it's really hard to process all that information, and to have an advocate in the things that you specialize in are a little different than the things I specialize in, but to have an advocate that can kind of walk you through that and look at the big picture, sort of the holistic looking at everything, I think that's really important. And it is kind of rare to find folks that can analyze and help people narrow down their options, get through the maze of long-term care insurance, or for me, it's going to be, government assistance. And just the process of getting through the healthcare system can be very difficult without a guide. And it's very hard to find a guide that will see you through the whole process.
I agree. What I found when I left financial services and I recommitted myself to healthcare, it was through a personal, situation with my dad, who was diagnosed with glioblastoma and subsequently passed. And I saw the silos that we were all working in, and I thought, wouldn't it be nice if somebody kind of worked across the silos like we did, and to some extent in financial services, that whole consultative approach. And I've asked healthcare people, why aren't we doing a better job in healthcare, reaching across the aisles, if you will, making sure that person completely understands what is happening and perhaps making that extra phone call? And I don't think that they really thought about it that way. And so at the end of the day, I want to be that unique service provider that actually asks that one more question, that actually says, you know what, you're thinking about this, but you also need to think about these three other things, and let me get you where you need to go. And it's been received well. And I feel as though companies that do this, and I talk about this in some of my articles, companies that do this are going to win, since there's going to be so many of us who are aging, who are a lot more aware of the complexities that we're facing, but just don't quite know how to solve for them.
It's very interesting trying to maneuver through any of these things, whether it be the healthcare system itself and just getting information. And I feel like I'll give you a quick anecdote of my own personal experience. I was going in for a simple test, and I was concerned. Never been there before. I said, talk to the person on the phone, can you tell me where do I go in the hospital? And they said, oh, it's the green elevators. And so I get to the hospital, there's no green elevators anywhere. Well, when I finally got to where I was supposed to go on the floor that they were on, the elevators were green on that floor. And so from their perspective, it was the green elevators. And
That's a great example.
Best, but there's nobody that is there to help sort of guide you through that process. I know that's a silly example, but that's just one of those things there's really not a whole lot of communication, especially from, one setting to the next setting. So if you're in the hospital and you go into rehab, or you go from rehab to home or anything like that, the communication across the different, expectations is very little, and you're starting over each time practically. And it can be very difficult without a guide, like you said.
I think so. And I think it's very stressful. I mean, I do a lot of talks and webinars, and the first question I ask is, how many of you have a loved one that has been discharged from the hospital, and you're thinking to yourself, they're not ready? And I mean, the whole entire room raises their hand. And guess what? That's the way of the world now. I mean, the hospitals have their marching orders based on what's going on with CMS, and the rest of us have to fall in line. I could go on for days about, the impact of what that means. But it goes back to, it's interesting, did CMS think about how much money they're going to save by managing healthcare this way, but the impact that it's going to have on, those of us who have to care for our loved ones, and have businesses, the role that businesses need to play in advocating for us, because they're the ones that are going to lose out on productivity when we are no longer, when we no longer can stay at work, we have to leave early, or maybe we forego that promotion or what have you.
This is not a complaint. It's just a reality that the agents that sell traditional long-term care insurance, which has gone through a major change over the last 20 years, from, I think I heard it was like over 100 and some companies down to maybe 3 or 4 companies.
Yeah, it's around 6. Yeah.
Okay, thank you. And so, but the issue on this is that the agents that sell it don't have, at least in my experience, much of an ability to help with the claims process. It's one of the things that when I had someone come to visit me that said, hey, I think you should send me some of your clients that need long-term care insurance. One of my questions was, how often have you been on the other end of it where you were trying to help someone file the claim? And the vast majority of the time it was, well, I haven't had that experience yet. And so you are on that side. From what I understand, you're not selling long-term care insurance. You're helping with that claims process.
That's right. And so, coming from financial services, so I worked on the clearing side. So our relationships were broker to broker, B2B, with all of the large brokerage companies in the United States. So, Bank of America, JP Morgan. So I understood how these brokerage firms worked. They wanted, and insurance companies like New York Life and whatnot, they wanted their reps on the phone, reaching out to new clients and growing the business. So the last thing they want their reps doing is potentially servicing their clients over and over and over. And I know this. So there's that influence on any advisor. The second thing is, a lot of these advisors have younger books, so they haven't really reached a point where somebody needs to, leverage their. Third, they don't know where to begin. So it's a hot potato and they want to just bounce it to someone else. So I want all of those. And so oftentimes an advisor, or whatever, I call them advisors, but they could be any number of licensed or CFA or whatever. They are happy to have someone like me, because at the end of the day, it's a relationship-based transaction. And if they can trust me and trust the process, then I'm going to be able to take care of the client, make their client happy, and then help them reach their benefits. But at the end of the day, when I see any kind of an advisor who is managing the claims too far along, I'm like, wonder what your boss thinks of that, because you're not doing what you're supposed to be doing. And I know that because I've been on that side. So
Well, and so in my experience over the years that with long-term care insurance claims, that it is not an intuitive process for most families. So when they purchased it, when they paid the premiums every year, they had one thing in their imagination. But as with any insurance process, you got to go through the process. And so, for example, obviously, many long-term care insurance policies can be used for home care and things like that. But when we're looking at some care like assisted living or other variations of that, sometimes there are expectations within the policy that the caregiving providers meet a certain level. And it's very difficult for the family to even understand that sort of fine print in there, which isn't necessarily a bad thing that the insurance companies are saying, well, they have to be licensed or they have to be supervised by medical or they have to, whatever the issue is. But it's not clear. That's not in the marketplace. No, but they're not putting on their sign, we're licensed as in Michigan, it'd be something called an adult foster care or a home for the aged, which are very archaic terms, but that's what they have for licensing. And so it's the families struggle with that. And sometimes insurance companies are insurance companies and they make you go through some hoops that the family wasn't expecting.
I would agree. And if a policy has been acquired by another company, they may interpret that language differently than the original intent. And so it is a little bit of an art. And I have several examples of that, which I won't bore you with. But the one thing that I see is the good news is a lot of times the policies that have, first of all, every policy is different. And I say this to every client, even if you could have 5 policies from John Hancock and every single one of them has got to be evaluated on its own. Wow. I've had clients that have 2 policies, but they're serviced now by 2 different agencies that do the back end. One will have an issue and the other one will fly through. But the thing that I find is, the levers that drive the premium, the biggest one is the elimination period.
Yeah.
And that is the one. I was even talking to an advisor who's been in the business. He's a CFA for 25 years. His parents bought a policy. And he actually, because I understand the elimination period, even though a lot of people don't understand that they have to pay out of pocket until that claim is approved. But there was even a nuance around calendar versus business days around care. And he said, I didn't realize that once the claim was submitted that I had to wait, 90 service days, not 90 calendar days. He goes, that's a long time. Right. So I think even the most educated, intelligent, detail-oriented person can get caught by the language and the intent of these policies. And that's why it's so important to have an advocate who's been through it and can ask that, 2 more questions to get down to the bottom level of what that, of what that benefit could mean. And then different scenarios. And I think it's important to show people scenarios so they understand how to play that policy out properly.
I generally recommend most people that are getting ready to file a claim for long-term care insurance consider working with you or somebody like you, because it is a lot of times they're 2 or 3 months into it before they start to get frustrated with the process, and they may have not made as much progress as they think they did during that time period, but they could have had they had sort of that advocacy and that sort of explanation of the policy to how we're going to properly trigger it or get through that elimination.
I would agree. A lot of folks think, I can't tell you how many clients have said, I don't really need it right now. I only broke my hip. I want to use it when I have some sort of honestly, I think they're waiting for that terminal diagnosis. Mm-hmm. And my advice is at any point before you even have any issue, you should sit down and walk through some scenarios on how to get through that elimination period with paying as little out of pocket as possible. And even if it means, a little bit of care that you might normally have been able to work through on your own, it means getting through that elimination period versus having to pay somebody when you're extremely ill 7 days a week, 24 hours a day. So I think that's the biggest aha. Yes. Around. And I think people thought, well, I've got insurance, I'll just file a claim. It's just like my car. It's like, it's not. Right. It is so not.
And I can't tell you how many people I've seen like that. And I ask the question, "What are you saving it for?" Yeah, that they have serious concerns, and I understand, especially when we're dealing with home care, that that's a big adjustment to have
It
caregivers
is.
come into your home, and sometimes families are just nervous about that.
Sure.
But the idea is, so many times I've seen people where they have severe physical restrictions, or they have some form of dementia, and they have this long-term care policy, and they're saying, well, we're going to hold on to that till later. What are we saving it for? Wasn't this what you bought it for? Wasn't this what you paid for?
It's amazing. I found it doesn't matter if you're, a blue collar worker. It doesn't matter if
Yes.
you're, a high net worth client. I've dealt with high net worth clients, family office. Well, family office, a lot of times they self-insure, but I dealt with a number of large attorneys' offices where they offered long-term care insurance as a benefit. So they took it, of course. And they would hold on to that policy like it was, a binky. So part of my goal in starting this company is to get information out there that, I kind of want to say, I wish they told me sooner,
Yeah.
because I think we're better at making decisions when we're informed, when we're not in crisis. And I think that my goal is to be the loudest voice in the room for those of us who really don't know what's coming down the pike.
Well, let's talk about one of your other areas of expertise, and that's selecting a home care agency.
Yes.
That's really interesting, and I think people really, they just aren't aware of the dynamics that are involved in the home care industry. So it's kind of like the first one that shows up on their list. Well, we called them, and so that must be what they're all like. And so walk us through what that looks like when someone's working with you on helping to figure out their home care situation.
Well, I think, there's a lot of assumptions. Well, I just want someone that my mom gets along with. And we know that it's so much more than that. And they're an extension of the healthcare ecosystem. And they're probably the most intimate versus, dealing with other healthcare providers. So, when I built my home care company, I came in without any healthcare background. I was basically an administrator. So I applied a lot of the risk management that I had when I was a registered principal. And so I came into the industry with, how would I run this business and make sure that when someone goes into someone's home, they're as safe as possible, and that I limit as much potential, fraud or any of the bad stuff that goes on when a potential home care company that's nefarious goes into the house. So the first thing that I do is as I sit down with the client or whomever the constituent is, and I ask them, what are the needs? And so I typically will get, the history of the person's health. Then I begin to discuss, what role do you want to play versus what role I can play? And a lot of times it's, can you do it? Can you just take it on? Because I'm overwhelmed with mom and I really need to be handling this. You take this on. So then what we do is we sit down and we discuss what the requirements are for the care plan. And that has to do with the diagnosis and various other particulars. I want the bed made a certain way. I want to eat, if she needs to have her tea made a certain way and what have you. So we create kind of a straw man of a care plan. And then I'll talk about what I would consider requirements for a home care company. And that's basically my experience behind the scenes. I'm going to want to understand what are the hiring practices. I'm going to want to understand if they're licensed or not, because not every single agency is required to be licensed. So if they're not licensed, they should be accredited, so they at least have a third party coming in evaluating their business. The longevity of the management, there's a lot of turnover in this industry. As you know, there's a lot of turnover with caregivers these days. So there's a lot of vetting when I evaluate these agencies as to the health of their infrastructure. Families aren't necessarily going to ask. I'm going to look at what are the reviews. A lot of agencies don't pursue reviews. It was something that I pursued because I know that a lot of folks go online right away. They want to see how the reputation is. So I create a profile based on my own behind the scenes experience of what a great home care company should be doing, how they should be responding. And what makes you different? Well, it shouldn't just be, well, we have great caregivers. It's got to be a number of other things around how you run your company, how you manage risk, how you hire, because guess what? Every one of those caregivers is probably working three or four other agencies. So, you've got to really get underneath all of those particulars. Then you create a profile and you create a recommendation that is positioned in a way that the family can understand and can resonate. And yes, it is about personality and fit. for mom, but at the same time, it is so much more. Do they have the experience necessary to care for whatever's wrong with mom, especially if there's memory issues? Because there is a specific type of skill necessary to deal with somebody who has memory issues. And, it's not a one size fits all. So, and, at the end of the day, that has worked really well. And we've seen agencies that appreciate the fact that they were so well vetted because it made for a better fit versus the, Friday afternoon phone call. I need a caregiver on Monday. And then wham, you've got a caregiver that doesn't fit.
Yeah. So, it's interesting how you describe that, because I think that's true with almost all long-term care, whether it be facility-based or home care. And that's how I always tell people that's how we evaluate, and we, encourage our clients, our families to evaluate it that way too, is it's not just about the physical location, how pretty it is.
Oh, the chandelier.
Yeah. It is about how it's run. And so the things that you mentioned are very important. How is it run? There always are going to be issues, right? There's always going to be concerns that people have when it involves caregiving. And how does management respond to those concerns? Do they ignore your phone calls? Do they just move on to the next person? And the way that you went through and said how you evaluate the home care, I think that's true for if you're considering assisted living or memory care or independent living or nursing home or any of the levels of care, because it's the same, it kind of comes around the same thing. We look at places that are very fancy, and our evaluation is they're not providing as consistent quality care as some of the older places that aren't as fancy, but have better systems and management in place.
I would agree. What makes a great agency and a home care agency is an agency that's willing to be honest and say, what, I think we've gone as far as we can with mom, and I think it's time to look at, alternatives. And so I would often get involved in evaluating alternative living arrangements. And, at the same time, my mom had dementia and my brother is an attorney, and the two of us had to find a place for my mother. And honestly, if you pulled up in the place that we found and selected, you'd think it was a yard sale. But it was an award-winning facility, long-term care facility. And my mom couldn't have been happier. And she had the very best experience. And this is somebody that was adamant about living at home until the end, but at the end she just couldn't. So I would agree with you that, this place was paneling and big fluffy chairs, but the food was amazing and the care was incredible. And I couldn't have been more proud. And they had all sorts of accolades and were recognized nationwide as one of the best. And I think that, and by the way, my brother and I stared at each other when we were going through this saying, are you overwhelmed? Because I'm overwhelmed. And I was in the business. So, it happens to the best of us. When you're in it personally, it becomes bigger than you. And by the way, we did have an advocate that helped us through, because I didn't think I could do it myself. And sure enough, this woman did a fantastic job. So
that's great. So then the other area where you're often helping folks age wisely is nutrition and fitness. So talk to us about that type of consultation.
So, a lot of us think that as we age, that we may not, that if we're healthy, that we can continue to move and to be active, and if we're starting to live with chronic issues, we should begin to slow down. And the answer is absolutely not. This is the time to evaluate where are you in your health. So I am an aging specialist, as I mentioned, with a certification in fitness, focusing on older adults, because aging, and a lot of folks in fitness don't want to focus on older adults because it is not a one size fits all. It isn't about just building muscle and lifting heavier weights. It is truly understanding and profiling who that person is, where they are in their healthcare journey, and then crafting a workout schedule that helps them not only live as well as they can, but manages whatever chronic issue they may be experiencing. So at the end of the day, it's not all about chair yoga. And although that is a very good exercise program, it's not necessarily something that everybody should look forward to.
Right.
So we educate our clients on resistance training and actual dumbbell training. And that, we don't talk about it in terms of, going to the gym. We talk about it in terms of functional goals. So I want to be able to go to Italy and walk around with my daughter for the next, 2 weeks vacation. I don't want to have to worry about that. And I've got, 3 months to get there. Or I want to be able to go to the grocery store and lift up those bundles without having to worry about my dropping them or being able to carry them into the house. I want to be able to walk up the stairs. I want to be able to come down the stairs. And there are areas of your body that you need to focus on as you age in order to stay functionally fit. How about getting on and off the toilet in the morning? Sometimes that can be a struggle. So let's talk about how to keep whatever parts of your body you need to keep strong in order to stay healthy. So profile our clients so that we understand where they are in their journey, what's their appetite for exercise, and then we build a program and we monitor that programming. And it's all done. I do have a studio here, but it can be done remotely, which is cool. So we do it via Zoom, and we communicate in writing so that they can see their written fitness plan, and nutrition as well. So, I'm a nutrition coach, so I'm not a nutritionist. So the coaching around meal planning, similar to when someone has, any kind of a health issue, we will put together meal plans that will assist in whatever the doctor recommends, but it's in concert with, it's not instead of.
And we see so much research. It's just coming out every day about nutrition and dementia, nutrition and, joint issues and arthritis,
inflammation,
and things like that. And nutrition can make a big difference in minimizing that in the future. There's lots of evidence now that good nutrition can minimize the likelihood of dementia. But even once you're showing signs of dementia, there's evidence that nutrition can assist or help with slowing that down or making it less intense. And so I think nutrition is a huge part of this process, and I'm happy that you're including that in your conversations.
Thank you. And I think the good news is I am my own client.
Yeah.
So all that I'm learning, I'm doing because, I came from Wall Street. So the life that I lived in Wall Street was a lot of, steak dinners and lots of wine. And I learned over time that, I wasn't aging as well as I wanted. And with all that I've learned and all that I've seen in healthcare, I've been able to personally make decisions that have impacted, how I'm living my life in my 60s better than I would have if I maintained, how I was living in my, my 20s and 30s and 40s. So, and then the experience that I had in watching people with memory issues when they have, nutritious diets and they're watching their salt and they're very cognizant that, their family members are very cognizant of what they're feeding their loved ones who have memory issues. You see a difference, and you see a difference longer than if you just had them eat whatever they wanted.
Right.
And so I'm a big proponent.
So tell us a little bit more. I wanted to get into all of those issues, and then I wanted to kind of circle back about how did you get this to be your passion? I know you kind of hinted around a little bit about it, but I'd like you to tell your story a little bit. How'd you get from Wall Street to the Silver Savvy?
Well, it's interesting. I did very well in financial services, and I think what made me different was I've always been, first of all, I've been a caregiver since I was 7 years old. So I've always had an incredible ability to understand what someone's thinking, feeling, and going through. And that put me in a very successful position when I was in Wall Street, because clients, no matter if you're a person or a company, they want to be heard. And if you can listen to your clients, assimilate what they're saying, even if they're yelling at you, assimilate what they're saying, bring it back and solution something that will mean their business will grow or it solves a major problem or whatever, then you will do well. And I did very well, and I built really successful teams. I migrated to fintech, and I worked in a bond trading company that developed software technology that had never been used before, and it actually was a game changer in the market. So I learned technology, how technology can facilitate business, and I've always loved being on the cutting edge of technology. I was always the first person to have a BlackBerry, literally, in my office. So I've always been somebody that was very adept at technology. I was always somebody that saw that as a solution. So when I started having experiences with healthcare and my parents, I thought, you know what, I can do this better. And I said, I'm going to do this better. So I went and bought 2 home care companies. and I did it better. But I didn't do it by treating the clients better than anybody else. I did it by treating the caregivers and hiring the absolute best caregivers and rewarding them just like we were rewarded in financial services. And suddenly, guess what happened? All the caregivers are at my door. So then I can service more clients, and these caregivers stayed with me. So I found the secret sauce to how to build a home care company and build it well. And I ended up selling that and decided, you know what, I've learned so much about wellness. I feel like I'm a bridge between financial services and healthcare. My home care company was very high tech. In fact, the person that the two gentlemen that bought my company walked in and said, "Where are all your files?" And I'm like, "They're online, guys. Like we are very, we're very tech savvy organization." And my staff loved it because they were on the latest technology. So Silver Savvy is really born out of all of that client facing, technology oriented solutioning that I've learned over the years. And at the end of the day, when you're really good at customer service, I think you can do it no matter where you are. And I think that I want to be at the cutting edge of doing something different for those of us that are aging and do it well.
That's great. You know what? There's a parallel to what we were talking about earlier and how we evaluate the home care companies and the assisted living and things like that. It is kind of a parallel over to any business because it is, if you have files strewn about everywhere, if you have everything in paper files, you're not going to be able to serve your customer, your clients, your patients all that well if you can't easily access their information. Because otherwise, it's just there's too much mess to be going through to be able to properly service those clients. So I think your embrace of technology is something that we all can learn from to the extent of, and it's one of the things I always say is my goal as I age is to try to stay up on technology. I know that's something that many seniors do struggle with, and I encourage seniors to if they need to go out and take a class or just expose themselves to it. Don't be afraid of it because it's one of those things that can really help you stay connected to your
and relevant.
family, stay connected to businesses, stay connected to services, all these things.
You're absolutely right. And you go back to the whole cognitive health and, staying connected to people is a huge element of healthy aging. And I agree. Technology is a really good way to do it, but it's scary for some folks.
Yeah. Yeah. And, I think for most people, it's just exposure. It's just don't be afraid of it. You're not going to blow up anything if you push the wrong button.
Yeah.
Just play around with it. And that's how most people are going to be more comfortable with technology. So, well, this has been a great conversation.
I loved it. I wish we had more time.
Want to encourage everybody to check out silversavvy.com. You can connect with Laura Lynn at linkedin.com/Laura Lynn Morrissey. And Laura Lynn, what other final tips that you want to leave our listeners or other ways they might reach out to you?
Silversavvy.com, hello@silversavvy.com is another way to reach out. But I'm very active on LinkedIn. I'm very active in email. And I am here to help. And I think at the end of the day, aging is unique to all of us. It's a personal journey. And I think that, looking for resources to help us age the very best we can, we don't have to take aging sitting down. And we need to make sure that we're doing it our way. And I think there's a lot of resources out there now to help us. And Silver Savvy is one.
And I want to point this out. I think we may have mentioned it earlier, but I really want to stress this, that Laura Lynn can work with anybody in the United States. It does not, the use of technology, but just everything that she does can be done regardless of your location. And so if you have a long-term care insurance claim or you're considering filing a long-term care insurance claim, if you need an evaluation of home care agencies or sort of just looking towards aging well, I strongly recommend that you consider checking out Silver Savvy and Laura Lynn Morrissey. Thank you so much
Thank you so much, Bob. This has been wonderful. I appreciate your time.
If If you like the podcast today and you want to be aware of our next one, don't forget to subscribe at any place that you download podcasts. You can also go to our website, mannorlawgroup.com, or we're also on YouTube if you like watching the podcast. But we really appreciate our listeners. You can go to any podcast place that you listen to podcasts and search for advice from your advocates. And don't forget to subscribe. Thanks, and we'll see you next time.
Thanks for listening. To learn more, visit mannorlawgroup.com.